So whatever it is, we need to calm the problem down. We go back to the drawing board and we need to figure out, what's potentially causing that plateau, the increase in pain. So reducing the irritability and, always thinking, if in fact is inflammatory. And this is where it's challenging because that mismatch in load capacity, for example, can also cause, a backward step in inflammation. And think and I think back to there's a psychological model written by Hans Selye, and it's about plateauing. And so this model is actually applied in physical training. And in fact, my professor for my master's and PhD program, Dr. Mike Stone, wrote an article. Look it up back in Strength and Conditioning Journal, and they talk about the monotony in training can actually not only induce a plateau, but can ingrain a plateau and make it even more challenging to get out of that plateau to move forward. And if you look at the model, the ultimate downside of doing that is not favorable. So then we need to get to a point where they can tolerate whatever it is that we're doing. And then we need to start getting to that loading effect. If we think about, again, our end goal and what we're trying to accomplish, we're trying to get people to move better, and therefore we need to create a loading scheme that's going to address that. And I put this down here, Big Mike's shoulder. So I had this dude, he specifically sought me out because he went to an amazing physical therapist, and he was specifically looking for someone to do shockwave on him because that's what he heard. And so um, his shoulder it was being hung on by a thread. He was in his early 60s, previous competitive weightlifter, but still trained very similarly. And the guy was just built like a brick house and didn't want to stop. And so, yep, we got some great relief, immediate improvements in range of motion. The problem was that, his loading on himself in the gym was way too high. And like I said, if you're going to get back to where you want to, dude, then you need to decrease that and you need to load the tissue to the appropriate capacity. Okay. So building that tolerance is really important, and we can do that with our applications here. As I always tell people, Mike, the threshold for biological influence is really not very high. And so, and I use the analogy hot sauce, and so I can always add more hot sauce, but once I put too much in, taking it out is nearly impossible if you put it in rice or something like that, right? And so, but the threshold for biological influences is actually pretty low. Now, the benefit of that and not inducing an adverse reaction is quite powerful, right? And so this is, applying radial shockwave where, and call this the lumbar spine. I may start off with 50 millijoules, which sounds probably really low to a lot of people. Or if you're thinking bar, 1 bar, at only 500 impulses, thinking, oh boy, that's a waste of time. Not really. It will desensitize the tissue, right? Which is one of the factors associated with either the plateau or the initial treatment with someone. But think about creating a non-adverse situation while having a positive aspect and building what you need to do with your patients, which is rapport and trust. The other thing that I talk about from a patient management standpoint is people know numbers. They may not know what the heck I'm doing to them, and you can explain it to them for sure. But when I say, yep, we started at 50 at 500 impulses, and then now, wow, we're at 80 and 1,000 impulses, and you're like, woohoo, I'm doing a little bit better. And then ultimately up to 100 millijoules at 2,500 impulses, right? So think about that very similarly in terms of like the volume load progression in exercise therapy. It's very similar where the volume load is the number of sets times repetitions times the resistance that you're using. And so you can actually calculate the dosing from this perspective, right? And so this allows me to kind of address the pain. It allows me to take a step back. It allows me to develop rapport. It allows me to have a positive aspect, which some of these types of therapies, and I will say shockwave is so good at desensitizing tissue and reducing pain near immediately for a very, very large percent of the patients. And that's the cool thing is because in some of our professions, they walk in and they have a they have the bar set pretty high. They're looking for something to happen and make sure that it's actually going to work.